Hello and welcome. Thanks for being with me today for my talk on a deep learning pipeline for patient diagnosis prediction using electronic health records. My name is Bibek Paudel. I'm a postdoctoral research fellow at Stanford University, and this work was done together with my colleagues at ETH Zurich in Switzerland. So to give a brief overview of what I'm going to present over the next 5 minutes, our work deals with the problem of multimorbidity, and we aim at predicting these multimorbid conditions using heterogeneous data sets in electronic health records. These data sets come from different sources and they belong to different formats. Some of them are structured and some of them have an unstructured form. For example, free-form text notes written by physicians. In our ongoing work, we're expanding the current work to integrate with network datasets and also domain expertise from medical experts. So let's start by looking at what multimorbidity is. Multimorbidity is a term used to define the presence of more than one disease or pre-existing conditions. And as the proportion of aging population increases throughout the world, multimorbidity is increasing in prevalence. And it is becoming a bigger and bigger problem in the healthcare system. The problem of multimorbidity was brought to sharp focus during the COVID-19 pandemic because people with pre-existing conditions and multimorbidities are at increased risk for infection from this virus. And even before COVID-19, multimorbid patients were known to be underdiagnosed as much as 71% of the times by physicians. So in this work, we exploit different kinds of data sets that come in electronic health records. For example, on the left-hand side, on the top, we see an example of structured data sets. For example, these could be the test results and measurements taken at different healthcare facilities. And at the bottom side, bottom part of this figure, you can see an example of an unstructured data set. This could be clinical notes and discharge summaries. We pre-process both of these data sets and feed them through neural network models and compare their performances to see which model does a better job at predicting the health conditions. The main contributions of our work also includes an open source Python library which we have released. This library helps transform a dataset like Mimic3 into an interoperable data format so that electronic health records coming from different sources, different hospitals and healthcare facilities can be merged and looked at in together with each other. Currently, this is a problem because of different formats that exist out there. So we hope this will be of use to anybody who's working with electronic health records. Next, we build predictive models using both structured and unstructured data sets. And here's an example of the attention output from the textual notes. This is an output for the prediction of hypertension. And you can see that the model's attention layer is assigning high weight to the words like heart and failure. We use deep observer. We call the models deep observer when they are working with the structured data sets, and the models working with free text clinical notes, they are adapted from clinical BERT. And for deep observer, we use fully connected neural network, recurrent neural network, and convolutional neural network. And we see that the CNN does a better job in predicting the outcomes. Similarly, while using textual notes, we see that Using textual notes of all 3 days of admission does a much better job at predicting the outcomes. We are right now working on improving these models by integrating them with other kinds of data set and building a combined model for all sources of data. We also compare it with SHIP here, although the comparison is not one-to-one because SHIP uses ICD-9 codes and we use CCD codes. We are also addressing this to compare with other models in this domain. So this work is a result of collaboration with Leopold and Yasura Shrestha at ETH Zurich, and in collaboration with my other mentors and colleagues. Please feel free to reach out to me for further questions and discussions. Thank you.